For years, Marty and David Goldberg have been separated by nearly 3,000 miles. But in an act that will test the bond of these brothers, Marty has traveled to Miami from California, not just for a visit with his older brother, but to save his life. With a genetic disease quickly destroying David's kidneys, surgeons right here in Miami will try a delicate and risky procedure that will transfer a healthy kidney from one brother to the other. It's a disease that has already claimed their mother.
Polycystic kidneys in our family goes back to my mother 20-something years ago. So we knew at that time through testing subsequently that Dave also had the disease. So we kind of knew the day was coming.
Right around a year ago, where I met with the nephrologist, and he basically told me the blood work was getting down to the nitty-gritty. So it's time to get serious.
Dr. Goldberg's kidneys are failing. He's reached that point where something must be done. He will die unless he gets either a kidney transplant or would start dialysis.
The dialysis scares me more. I'm not concerned about going through the transplant. I'm a lot more frightened about long-term dialysis and its side effects.
Two brothers, two surgical teams, banding together in a battle against time and disease. Hello, I'm Jay Adams and welcome to Breakthrough Medicine. You might be surprised to learn that an estimated 20 million Americans have chronic kidney disease, and most don't even know it. And it's more likely to occur among minority groups like African Americans and Hispanics. Chronic kidney disease is often caused by long-standing diabetes, and what makes it so dangerous is that over time it can lead to kidney failure, also known as end-stage renal disease. That describes more than 500,000 Americans who right now require maintenance dialysis or are waiting for a kidney transplant that may never come. Dr. David Roth is medical director of the kidney transplant program at UHealth, University of Miami Health System, and he calls it the silent disease.
Well, in the United States now, kidney disease is unfortunately a rapidly expanding health issue. The leading cause of kidney failure in this country is diabetes. And the second leading cause of kidney failure is high blood pressure. If patients don't get seen by a doctor and have perhaps some blood tests or have a urine check, they're not going to know they have kidney disease because you don't feel it. It's not like if you have heart disease and you have chest pain. Kidney disease tends to be a silent disease. And you won't know that you have this problem unless you have some type of analysis with a physician.
The kidneys filter waste from your bloodstream and eliminate harmful toxins and excess water from your blood in the form of urine. The body simply cannot function properly without at least one healthy kidney. For more than 3 decades, dialysis has been the most common way to treat advanced kidney failure. With dialysis, the blood is slowly pumped through a machine about the size of a small refrigerator that does the job of the kidneys. For some, it's a lifeline. Others, like West Palm Beach dentist Dr. David Goldberg, hope to avoid dialysis with the gift of a kidney from a living donor.
My disease, PKD, which is polycystic kidney disease, is a genetically inherited disease. So when my mother was diagnosed back in the early 80s, all the children, there's 5 children, were tested genetically to see if we had the disease or not. I was the only one of the 5 that actually had it. Most of what I feel at this point, weakness, very tired, very little energy, a little bit of nausea, funny taste in the mouth because the body chemistry is just not right. The biggest thing is the lack of energy, lack of strength.
That could change in just a few days when David receives his brother's kidney. The organ will be transplanted by Dr. George Burke, director of the Division of Kidney and Pancreas Transplantation at University of Miami Miller School of Medicine.
Dr. Goldberg has known about this for many years, and has been followed medically for a long time. And so one of our goals is to be able to transplant a patient with ongoing renal disease progression, to transplant them prior to them needing dialysis.
David Goldberg has been seeing me for a genetic kidney condition for the last several years now, and he reached end-stage kidney disease in the last year or so, at which time he was referred to the University of Miami Health Systems for a transplantation.
Telling people you need a transplant and asking them whether they would be willing to be tested is a difficult thing. It really is. The University of Miami was really good. They have a lot of instruction, pamphlets, they have people to talk to help you do that, to give you instruction on how to do it and how to get the point across the right way.
So when he called me in December of last year, he asked me if I would be tested, and I had absolutely no problem to step up and get tested. I was somewhat familiar with the routine, having been tested as a possible donor for my mom 20-something years ago. That obviously did not work out, and we were not a match. And in hindsight, maybe there was a larger-than-life reason why I did not donate kidney to my mother at that time, so I was available to be here today donating for my brother.
The issue about organ donation is that the supply of organ donors doesn't come close to meeting the demand. Part of the solution to this problem is increasing the number of living donors. Beyond the optimal kidney, you also have a genetic match, and so less of a predisposition to the potential for rejection. And so what this ultimately translates to is a longer survival of the kidney transplant in the recipient.
The brothers turned to the team at University of Miami Health System and Jackson Memorial Hospital, the same place their mother underwent a successful transplant.
We came to be involved with the testing and eventually the surgery at University of Miami Jackson Memorial because that goes back to both when my mother was being tested and treated for her polycystic kidney. So very familiar with the staff and the hospital, and clearly University of Miami Jackson Memorial was head and shoulders the largest center and really, with regards to the state of Florida, the place for transplants.
The UHealth Kidney Transplant Program are one of the busiest programs in the United States. In fact, last year we were the second busiest kidney transplant program in the entire country.
PKD is a genetically inherited disease. My mother had it. Of the 5 children, I'm the only one who got it. So when I was deciding with my wife at the time to have children, a big factor was, do we want to have children on our own? And if we do, there's a 50-50 chance that those children are going to have the disease. So we decided to adopt rather than have kids naturally. And that way I know that I'm the end of the line, the disease is done in the Goldberg line.
If we did not go through with this procedure, my brother, I think, would remain obviously on the recipient list, hoping for either cadaver donation, or he will be on dialysis, and dialysis has a very dramatic effect on one's health and one's quality of life.
Marty and I had spoken about the possibilities after the transplant is done. And one possibility is either rejection or that the kidney function is just not where it's supposed to be. And if that's the case, then probably dialysis is going to be the next thing. I'm not concerned about going through the transplant. I'm a lot more frightened about long-term dialysis and its side effects.
When we come back, we'll witness the love one brother has for another and the bond that will place them in the hands of one of the most skilled transplant surgical teams in the nation. We'll be right back. It is the morning of surgery, and David is only hours away from receiving a healthy kidney from his brother, Marty. The journey begins as Marty is taken to surgery while David waits his turn.
He's a good man. He's a good man. There's no doubt when I remember making the call. I said, Marty, it's time. And he's like, okay, what do I need to do? That was it. No doubt. No doubt. So, yeah, I'm really lucky. really lucky.
As far as risks to the procedure, anytime anybody undergoes general anesthesia, there's a risk. We are extremely careful and meticulous in our evaluations, and particularly the cardiac evaluations.
The next several hours will be extremely intense for his team of surgeons, nurses, techs, and anesthesiologists. Even after thousands of transplants, it will require careful teamwork by dozens of professionals to ensure the surgery is successful. This is no routine operation. Surgeons begin by making an incision in Marty's lower pelvic area. Because of the significant blood flow to and from the kidneys, the team must be both fast and precise.
So we're going to put the ports in now, Aliana, and this will allow us to insufflate the abdomen so that we can get space within the abdomen to work laparoscopically, and also allow me to put my hand in so that we can use hand-assisted technique to perform this surgery.
The procedure to remove Marty's kidney is well underway. With no complications so far, it's David's turn to be moved to surgery.
As we're doing the procedure, we make an incision in the right lower quadrant, and we travel down and we expose the artery and the vein that are nearby. It's called the external iliac artery and vein. And once we have enough of a length there, we receive the kidney from the other room, and we bring the kidney in and prepare the kidney so that the length of artery and vein of the kidney are appropriate. And then we connect the artery and the vein of the kidney to the artery and the vein of the recipient. Then we release the clamps, we watch the kidney to make sure that it becomes well perfused and that it becomes pink from the top to bottom. And then usually within a few minutes, that kidney will start to make urine. All right now I'm starting to prepare the back table. So once we go next door to pick up the kidney, we'll pick up the kidney, and this is a basin of ice and saline. Put the kidney in here, bring it back, and be ready to flush the kidney with the perfusion stuff.
The kidney is looking very good, and we've dissected now out the renal artery and renal vein. If you back up, show him the kidney. Here's the kidney, back up so we can get a panoramic of the kidney. It's very nicely perfused, doing well. So we're just completing the dissection of the kidney just to make it ready.
In the next room, just a few yards away, David's surgical team has prepared him to receive his brother's kidney. The surgeries must be carefully coordinated to minimize the amount of time the kidney is outside of the body. Every minute counts.
All right, so now we're going next door.
Single artery, single vein, I think it's going to work well for you. Looks pretty. Long awaited for.
Thank you very much.
Good luck.
Surprisingly, David's damaged kidneys will not be removed. Surgeons will simply place the new organ in the lower side of his abdomen and connect it to the nearby blood vessels and bladder. Finally, the vein and artery of the new kidney are connected to David's vein and artery. This is the most critical part of the surgery.
So we are now making an opening in the external iliac vein, and we will be suturing the renal vein of the transplant to the external iliac vein of the recipient. So the kidney goes into a different position from the native kidneys. It's a position that's closer to the bladder so that the ureter will be able to reach to the bladder. Okay, so we're going to release some of the clamps. We do the venous clamp first, all right, and then the distal clamp, and that looks good, so it's no bleeding. And you can see the kidney starting to turn a little bit of purple, which is what happens after it's got venous flow. Okay, now we're releasing the distal artery. Good. Now the proximal artery. Good. Now I'm opening it up, so there's no bleeding. And now I'm going to show you the kidney. And you can see it's pink from top to bottom. That's beautiful. It's a lovely kidney.
More than 6 hours after starting, the surgical team is closing the incision on David before moving the brothers to recovery. They will be closely monitored as the team waits to see if David's body will reject the organ, placing him back on the transplant list, or if Marty's sacrifice has saved his brother's life.
My expectation is going to work straight away, and it's going to do well for him. So he'll never, his brother will never need dialysis, and he'll have better long-term results than if he were to have a cadaver kidney or if he were to wait till he went on dialysis. So he'll do very well indeed. What's special is that the only indication to have this operation is the gift of love. So it's a very unique situation where someone actually has an operation they don't need, and it's to save a life and to give his brother back his life, essentially. So it's a very precious, precious gift. But what a lot of people don't realize is that he'll save 2 lives, because the fact that he's a living donor means that there'll be another kidney available for someone who's unknown on the cadaver list, and so that makes it very special. Mr. Goldberg.
How are you?
And Dr. Chen, I didn't meet you this morning.
Yes.
I'm Marty's surgeon.
Okay.
I just finished, and
Okay.
he's awake, and he's quite comfortable, and he did very, very well.
He did?
Yes, he saved his brother's life,
I know.
and he's doing very well.
Everything went textbook. The kidney is working. Dave is fine. Everything worked out beautifully. You can't explain the feeling, and we know it's all over. The suspense, everything. You know, you're able to breathe normally again.
When we come back, we'll check on their progress. To learn more about the organ transplantation program, log on to uhealthsystem.com. We'll be right back. It has been 6 weeks since UHealth surgeons at Jackson Memorial Hospital transplanted one of Marty Goldberg's kidneys into his brother. Although he experienced a few complications, David remains optimistic.
It's been 6 weeks since transplant surgery. I'm starting to get back to my activities, which were very restricted after the initial kidney transplant. Simple things like chores around the house, cleaning up, taking out the garbage, getting the mail, stuff like that, which I wasn't allowed to do for at least 2-3 weeks. So it's nice to get started back on my normal life activities. One of the things I'm waiting on doing is playing golf. I love to play golf, and too much twisting and too much strenuous activity doing that. The doctor said you need to wait a minimum of 3 months before you start doing that. So I'm just biding my time and waiting for the okay that I can get back to playing golf again. But I can't complain. Slowly but surely, I'm getting back to normal life.
Hey, brother.
Very good.
Got a little spread for you.
Sweet.
What would you like?
My brother Marty has been a godsend for me. He has done above and beyond the call of duty of anyone I could have imagined. Not only was he my donor, donated the kidney for me, but as soon as we got home and he got back on his feet, within a week, 10 days, he then changed from donor to caretaker. And he did everything for me because I was not allowed to do anything. The first 2 weeks is pretty much in the bed or in the couch. So he became the caretaker, cooking, cleaning, laundry, doing everything for me. I owe him so much. I don't know how I'm going to repay him, but he has been above and beyond the call of duty.
My brother and I were certainly close growing up, and certainly very close in the past year as we've been going through all the testing leading up to the surgery. And I would think now we've added the additional bond of the kidney for our relationship, and certainly we've already been making plans about activities that we will be doing together. We've had a great relationship. Now we share a body part, and I'm sure we'll share a lot more good times in addition to that.
Advances in surgical techniques and medications are making living donor transplants like this one not only more common, but safer.
Our program has always been involved in clinical research, and so clinical research means essentially what can you do to improve the outcome of patients. Every transplant recipient receives medication that's generally called immunosuppression, and the immunosuppression entails those medicines that are given to you to prevent rejection or to try to prevent rejection. And so for years we've been involved in clinical research and protocols for immunosuppression, and ultimately trying to fine-tune the immunosuppression that we use at the time of transplant in order to obtain the best outcome for patients. And so we have trials that go back over 2 decades looking at that, and our current immunosuppressive protocols we believe to be among the best in the country.
There are actually a lot of misconceptions about both organ donation and the long-term consequences of organ donation. Unfortunately, we come up against this all the time, and we try to educate patients to understand what the facts are so they can make an informed decision about whether they want to donate a kidney. And very clear scientific studies that have been done over decades of time have shown us that if a proper clearance is done, make sure the patient's healthy when they donate, that their kidneys are normal when they donate, that person is going to have every expectation of a normal life. If we had more organ donors in this country, we could save lives of people who are dying not only from kidney failure, but heart failure, liver failure, and other organs. Real lives can be saved if people will consider being an organ donor, but it means thinking about it, carrying an organ donor card, and speaking to your family and loved ones that these are your wishes.
Just 3 months after kidney transplant surgery with the University of Miami Health System team, David Goldberg finally gets his wish, a round of golf with his brother, with both in perfect health.
A couple of years ago, before the transplant, I was playing golf with a friend of mine, and I couldn't play past the 12th, 13th hole, which was very disturbing to me. Golf is one of my real pleasures. So being out here with my brother and playing golf and having the strength and not getting weak in the middle is just the most fantastic thing. I never would have imagined 3-4 years ago that I was going to be able to do this again. But the transplant enables you to get your life back. My strength is back. I get up early in the morning. I wake up every day with a smile on my face. Life could not be better.
One of the things that I was really impressed at through this entire process was the care that they take for both the recipient and the donor. Everything from the initial consultation, the education that they give you, all the meetings with everyone from social workers to the donor and recipient teams to the actual surgical teams was just fantastic. I forgot to ask you, how is the scar healing? How are you doing?
Sweet, beautiful.
I'll show you mine if you show me yours.
Okay, let me see yours first.
Doing great.
You go first.
I'm doing great.
Wow.
Just got 1, 2, 3. This one's not even hard anymore.
That's awesome.
Baby's a little hard. I'm getting my abs back.
That's really come a long way. That looks great.
Yeah.
Really good.
Absolutely no issue, no pain.
I like
Everything
it.
feels good.
No tenderness, everyth's good, huh?
Yeah. Now let me see yours.
I don't know if, you know, I'm a little further south than you. On these educational shows, I don't think that's such a good thing to be showing on TV.
We'll hold that one for home,
yeah,
shall we? Okay,
yeah.
after hours.
But just for your information, everything has healed beautifully.
Healing
No residuals, feeling great.
No pain?
Oh yeah, no problems at all.
More than 80,000 Americans are waiting for the gift of a kidney, but every year almost 10% will die waiting. You can help change that. To learn more about the organ transplantation program at UHealth, you can email a member of our transplant team by logging on to uhealthsystem.com. I'm Jay Adams, inviting you to join us next time for Breakthrough Medicine. Thanks for watching.